My next person I want to talk to you about is someone where I really did want to use the sour flavor. This woman is 45 years old, and she sweats at night. She has insomnia and dreams where she's very worried about not doing her job well. She has stomach ulcers, and she can't eat anything that's too dry or hard. So crusty bread or glutinous rice or anything like that is very difficult for her, and her stomach will actually be quite painful. She belches after eating all the time, and she's very constipated. When her bowels do move, they're very dry. She's thirsty, and she has bad breath. This patient, I absolutely want to use Bai Xiao. And not only Bai Xiao, I want to consider some other sour herbs. The very first thing I thought of with this patient is I want to cool her body and I want to restrain. I want to gather. I want to astringe. So I know right off the bat if I say I want to cool her body and I want to astringe, I want to gather, then I'm going to be looking for cool and sour herbs. Besides restraining the liver from overacting on the stomach, the cold and the sour will kind of gather. It will help me treat the night sweats. So for this patient, my formula was Sheng Shigao, Dan Zhuye, Lugan, Mai Mendong, Bai Ziren, Chao Zhao Ren, Bai Xiao, Fu Xiao Mai, Cao Jiaming, and Zhimu. I'll write that on the board for you guys. I purposely didn't want to use any bitter herbs in this person's situation because I didn't want to clear heat and dry her out. So I've purposely included cold and sweet herbs, cold and sweet, cold and acrid, cold, Bai Xiao, cold and sour. I want to build yin. I want to use sour herbs that are going to restrain the leakage of sweat. Chao Zhao Ren is sour. Bai Xiao is sour. Fu Xiao Mai is one of those herbs that is in the astringe category. It's great for somebody's just a little unsettled and you kind of need to gather a little bit, but it's actually neutral. It's not a sour herb. I also wanted to use herbs that were a little bit almost oily, like Cao Jiaming and Bai Ziren, to help nourish the body. And again, that's one of those things where if you look at Bai Ziren, you just touch it with your fingers. It's oily. There's not a lot about it that's going to go up and out. It's definitely going to go in. It's going to moisten yin. So with sour, we want to think about it if we have patients that have lumps or tumors or areas of gathering in the body, or again, that more yumen, the qi constraint of brooding and depression. Sour will help us pull in the liver qi if the liver qi is in excess. Somebody that's really angry and really needs to be calmed down, that's appropriate perhaps for sour. But if there's not enough, if the qi is stuck because the yang isn't moving, then you don't want to pull in more. Or I should say we should be careful. And when you use an herb that's sour, you just want to stop and think, do I want to gather? Do I want to astringe with this patient? So Zhang Zhongjing removes sour from a formula when there's chest depression, like in Guizhi Chu Xiaoyao Tang or Guizhi minus Xiaoyao Tang. This chest depression is because of the yang is damaged by the improper treatment of the Taiyang illness. And so here he's working solely on the yang by having warm and acrid Guizhi, having Shengjiang, having Dazao, and Gansao. But in the Taiyin chapter, Guizhi Tang has double the dose of Xiaoyao in Guizhi Jia Xiaoyao Tang. So we have Guizhi minus Xiaoyao, and now we have Guizhi double the dose of Xiaoyao. This formula is for a Taiyang illness that was treated by purging, so the yang of the body has been damaged. But this patient has a swollen and a painful belly. They also have diarrhea and a weak pulse. So this diarrhea is that the yang is not holding in. So we want to help the yang. We were just reading when we really wanted to help the yang, we removed Xiaoyao. We removed a sour herb because we just really wanted to make sure we're helping the yang. In this one, we really want to help the yang, but the diarrhea is just leaking out. They're losing fluids, so we have to gather. Not only do we have to gather by having a little bit of Xiaoyao, the Bai Xiao in this formula is doubled from the original dose of Guizhi. So we're warming and building but we're restraining. We have to protect the yin. We have to stop the diarrhea. Also important to note is that these two examples are Guizhotang modifications. Neither of them are treating somebody with an exterior illness. Please don't think that you have to wait until your patient had a Taiyang illness and then was mistreated, improperly treated before you can use these two formulas. That's not what the Shanghanlin is talking about. These two formula, Guizhor Chu Xiaoyao and Guizhor Jia Xiaoyao, or Guizhotang minus Xiaoyao, Guizhotang adding Xiaoyao, they do specifically treat the situation that Zhang Zhongjing talks about, and they do it really well. But they can treat a lot of other situations as well. Zhang Zhongjing is giving us specific examples, but again, the point is to understand the theory. A patient that has deficient yang where the qi isn't moving and it's getting stuck in the chest, you want to use warm and acrid herbs and don't use sour. If you have a patient that's deficient yang but a swollen and painful belly and diarrhea, we want to use warm and acrid herbs to build the yang and sour to pull in. So those are great examples again, and I think that if you look at the formulas that way, you'll be able to use them a lot more than just in the situations of the Shanghanlin.